Welcome to the Chamber Chat. I'm Matt Ricker.
And I'm Catherine White.
And we're here today with Dr. Seth Cohen, the Chief of Gastroenterology at Montefiore New Rochelle, and Denise Bird, Nurse Practitioner. Thank you both for joining us today.
Welcome.
Thank you for having us. Yes.
So Denise, I'll start with you. What sorts of areas do you specialize in at Montefiore New Rochelle, and how long have you been there? Just tell us a little bit about yourself.
So I've been there for a long time. I was a SoundSure employee, and then we transitioned to Montefiore. So it's been
a while.
20 years.
Yeah.
And my background is really oncology.
Okay.
And what's really neat about the position I have now is that I get to do cancer screening as opposed to cancer treatment.
Okay.
So a little bit on the happier side, as it were.
So, and what sorts of areas do you focus on? Or are you kind of general?
We are a general practice. We do see everybody with
Okay.
all sorts of GI issues, whether it be epigastric pain, diverticulitis, colon cancer screening,
Okay.
a variety of illnesses.
Yeah.
Okay.
All right. So, Dr. Cohen, since you are the Chief of Gastroenterology, I understand that March is Colon Cancer Awareness Month.
Yes.
So very timely that you're here. So tell us some of the symptoms that someone may feel if there's an issue in their colon or gastro system.
Sure. So speaking about colon cancer, we look for change in bowel habits, a low blood count, anemia,
Okay.
blood in the stool, something like that. But I think it's important to emphasize that for patients, even if they have no symptoms, starting at age 45 or age 50, should get screened for colon cancer.
Okay.
And that's a colonoscopy, right?
Yeah. So screening by definition means that you're investigating patients who have no symptoms.
And if you have a family history of it, should it be earlier?
So that's a good question. So we only look at first-degree relatives, so mother, father, brother, sister, not grandparents or
Okay.
uncles
Okay.
and aunts. But if one of your parents had colon cancer, it increases your risk of colon cancer by threefold. And so we recommend usually 10 years younger than the age that the person was diagnosed.
Okay.
So if the patient was diagnosed at age 55, then everyone in the family should be, starting screening at age 45, something like that.
Okay. When you have a diagnosis, what is the first step that you walk the patient through?
A diagnosis of colon cancer.
Yes.
Yeah. So I'll just mention that colon cancer is the second leading cause of death of Americans.
Oh
now.
my gosh.
Oh, I didn't know that.
Yeah. And there's about a 4% incidence in people's lifetimes. That means if you put 25 people in a room,
Okay.
one of them will have colon cancer in their lifetime.
Wow.
Wow.
And there are 150,000 cases, new cases diagnosed every year.
Wow.
Wow.
And 20% of those cases are people who are younger than 55.
Wow.
Really?
Okay.
Wow.
This question can go for either of you, but what would you say your advice is for those who get a diagnosis? No matter what the stage is, what would you say the first piece of advice that you would give?
Well, having taken care of patients with cancer for such a long time, it's certainly nobody ever wants to hear that they have a cancer.
Right.
And it's always a sad time, but there's so much hope out there. And nobody should ever give up hope.
That's what I was going to ask. If you catch it early, if someone comes in, I have no symptoms, but they get screened because of their age, and everyone should know that most insurances cover it completely because it is just almost a routine exam you should have after a certain age. So if I come in and surprisingly you catch something that I haven't been feeling or really showing symptoms for, is there a good chance of recovery?
Yeah. So 100%. So the idea of screening is you look for polyps and remove polyps before it becomes cancer,
Okay.
or you diagnose it when it's at an early stage. So if you have stage 1 or stage 2 colon cancer, you have 90% survival at 5 years.
Oh, that's great.
Wow, that's pretty high.
Yes.
Um,
So that's the advantage of early diagnosis.
yeah.
And that's why we want to encourage people to come in and have their colonoscopies at an early age. We don't want to wait for people to have all of the symptoms that were described earlier, where people have bleeding or pain or unexplained weight loss or anemia. We want to see people when they're healthy and have them
Sure.
come in and get a routine screening exam.
Yeah, I think sometimes people put it off because they're thinking to themselves, oh, you got to get anesthetized, you got to bring somebody. But the reality is, it could save your life.
Absolutely.
Correct. A lot of people put it off, paradoxically, because they're afraid we'll find something.
Right.
Which really makes no sense, because if there's something there, you want to find it and you want to take care of it.
Right.
Yeah, before it gets worse.
Yeah, and a lot of people have anxiety about anesthesia. We give very good quality sedation to the patients. We give intravenous propofol. Most patients wake up and say, gee, that's the best sleep I've ever had. If I knew it was so easy, I would have done it years ago.
That's good to know. So
Yeah.
definitely. So it's not a crazy, it's through an IV for the
Correct.
anesthesia.
And now, when you have patients that come in and they have to start treatment, being that you guys are based out of the New Rochelle campus, do you have all the facilities there to start with the chemo, or do they have to be sent elsewhere?
So we don't give chemotherapy in New Rochelle at this time.
Okay.
That service stopped with the pandemic.
Okay.
But we have a partnership with White Plains Hospital.
Okay.
So we refer our patients there for infusions.
Okay.
And is there, just because this is my ignorance, are there surgeries that you sometimes do for cancer?
Yeah. So, going back to your first question of what happens if you get the diagnosis. So the first thing is you do a colonoscopy. If you see something that looks like a cancer, you have to do a biopsy. You wait for the biopsy. If the biopsy shows it's cancer, then you need to get a CAT scan in order to stage the disease. Because if you don't see any spread of disease, if you don't see any metastatic disease, then you would do surgery
Okay.
to take out that part of the colon
Okay.
and put it back together, no bag.
Nice.
And then based on whether the lymph nodes are involved or not, you'd recommend, if the lymph nodes are involved, you probably would recommend adjuvant chemotherapy afterwards. If the lymph nodes are not involved, then probably you wouldn't recommend chemotherapy. So again, that's the advantage of early
detection.
diagnosis.
Okay.
Now, if it's spread elsewhere, stage 4, then you probably wouldn't have surgery, and the primary treatment would be chemotherapy. And that's more aggressive chemotherapy to kill the disease, but then also has more of a side effect profile.
Right. That's what people think about.
Can you explain the difference between immunotherapy and chemotherapy?
So yes, immunotherapy is more targeted therapy. It's aimed specifically at
Cancer cells.
the cancer cell or the mutation on the tumor, as opposed to chemotherapy, which kills good cells as well as bad cells, and that's why people who receive chemotherapy have more side effects.
Yeah.
Got it. So
Okay.
now, if I could,
I'm sorry. So right now, unfortunately for colon cancer, we don't have any specific immunotherapy. So each cancer is different. So
Yeah.
some cancers have very effective immunotherapy. Colon cancer, that hasn't happened yet.
Okay.
So more of the time it's going to be systemic chemotherapy with the with the good effect and the
Bad effect.
the bad effect.
So I'm sure it's currently in progress, trying to
Correct.
get immunotherapy for.
Yeah, they look at vaccines, they look at immunotherapy.
Okay.
so while I appreciate that March is colon cancer awareness and everyone should schedule something, what else do we do in the gastroenterology field? So what else are we studying? What other diseases are we working with? When does someone go to a gastro, other than the colon cancer?
So we see a lot of acid reflux disease.
Okay.
People,
Yeah.
heartburn, esophagitis, problems swallowing. We see a lot of people who have Crohn's disease or ulcerative colitis,
Celiac.
Celiac disease. 2% of the population has celiac disease, so that's we're always looking for that.
Yeah.
People who have chronic diarrhea, chronic constipation, people with pancreatic insufficiency.
So it covers a lot in that field.
Yeah, and it's such an important form. I mean, I'm sure you're doing endoscopies several times a week. For various different reasons, looking at the esophagus, looking at for heartburn.
So we have a very good outpatient endoscopy service, Montefiore, New Rochelle, doing 3,000 endoscopies a year.
Okay. How many do you do in a week?
As many as I can.
Same with the colonoscopies?
No, so on a busy week, you're going to maybe do 25 procedures on a busy week.
Okay. Yeah. Okay.
Okay.
16 on a less.
Yeah.
It varies.
Okay. Now, what would you say, if someone's looking to become a nurse practitioner and a doctor, what is your main piece of advice? We'll start with you.
So I think, nursing is a field that is all about caring for people.
Definitely.
And that's why I went into it a long time ago. And I became a nurse practitioner because it allowed me to expand my scope of practice, and I can help people in a way that I couldn't help them as an RN. So I really love what I do. I get to do some of what Dr. Cohen does and some of what I did as a nurse, and combine and blend the skills.
So if anyone is considering that career track, roughly how much schooling is required or certifications? How many years does that take to become a nurse practitioner?
Well, when I did it, it was a master's degree. Now the young students are required to get a doctor of nurse practitioner, so it's 3 years beyond that.
Beyond the master's? So it's an undergrad, a master's, and then 3 years on nurse practitioner. I mean, it's a very important certification, without a doubt. Okay.
Yeah.
All right.
And
Dr. Cohen?
Yeah.
Yeah, so I'll just make a pitch that nursing is an excellent entryway into medicine because you have a great diversity. You can do clinical med-surg nursing in the hospital. You can do administrative. You can go on to become a nurse practitioner. Outpatient medicine gives you great versatility in terms of a lot of different opportunities for people to look where they're going for. Medicine also gives you a lot of opportunities. The problem is it's a longer road. 4 years of college, 4 years of medical school, then 3 years of internal medicine. If you want to do gastroenterology, another 3 years of gastroenterology.
Wow.
So that's a lot of schooling.
That is a lot of schooling.
Yeah.
And I would counsel people to look at the economics of it. First of all, it's very competitive to get into medical school.
Right.
But if you can get into medical school, then you have to look at the economics. So if you can graduate from medical school with very little debt or no debt, then it's a good deal.
That's amazing.
But there's some people who graduate with $400,000 of debt. And very tough to get out from under that, because very hard to buy a house because you already have a mortgage.
Basically, yes.
Yeah. I mean, you could easily spend like a lifetime paying that off, depending on.
Yeah, so unfortunately the economics of medical school has changed in my lifetime.
Right.
And you see now some of the elite medical schools are free now.
Right.
Einstein, NYU are tuition free.
Yeah.
So obviously those are the most competitive schools.
Yeah, and that's all through the support of donors and philanthropy.
Philanthropy. Big philanthropy.
Yeah.
And Montefiore is connected, correct, to Einstein?
Yes.
Yes.
So do you often get doctors straight from Einstein Medical to yours or to Montefiore, or do you get them from a range of schools?
A range of schools.
Nice. Any final advice that you would like to give our listeners and viewers? Not just about colon cancer. It could be about anything.
Well, I'd like to mention something about colon cancer because I think this comes up in our office.
Yeah.
There's another screening modality for colon cancer, and it's called a Cologuard. You may have seen commercials about
I
it.
think so.
Oh, yes.
It's a test that a primary care provider can order. We can order it for a test for a patient. If the patient doesn't want to proceed with a colonoscopy initially, or if the patient's got complex medical problems and is a high risk for anesthesia, that may be an appropriate use of the tool. The patient, we would order the test, and the company would mail a kit back to the patient's home. The patient just provides a stool sample, and it gets mailed back to the company, and the DNA is analyzed in the stool. And then we get an answer, it's positive or negative. If it's negative, we don't need to do anything else. If it's positive, then the recommendation is to proceed with colonoscopy.
Okay.
Okay. So it's not always a first step for everyone, but for certain specific conditions, it might be a first step.
It may be, yes.
Yep. We're often asked, like, which is the best screening test, you know, because you could do a stool test for blood, you could do a Cologuard, you could do a colonoscopy, and the answer is whichever test the patient will follow through on.
Ah, that's a good point, as opposed to someone walking out with a script for a colonoscopy and never going.
Correct.
Well, I mean, could someone say, I want to do all three of them?
Yeah, that,
Or
I
is
mean,
that
you
like
could,
overkill?
but-
Could,
That's
but
a
it's
very-
not likely
that's a-
that the insurance companies will pay for all three.
Yes,
No,
because that's
but
a very
I mean,
enthusiastic patient.
if you're gonna go through the colonoscopy, then you probably don't need the stool test. So the stool tests
Yeah.
are either for people who are reluctant to do colonoscopy or have medical contraindications.
Is there any way to get around that liquid that the patient has to drink?
Good question.
Drink prior to the procedure?
You
Right.
sound like one of our patients.
Right. So I would say
Everybody.
at this point, that's the Achilles heel of colonoscopy. Everyone hates the prep. There are, you know, newer small volume preps, and, you know, it's always unpleasant. No
Yeah.
solid food. It's always, but there are newer, better ways. And for people who really refuse to do it, then stool tests are an option.
Yeah. Okay.
And is there anything else you'd like our visitors, our viewers to know on any field in gastroenterology?
Look, I think good health habits are important. Enough sleep, exercise, a reasonable diet, limiting alcohol, fast food, exercise. Those are all, certainly for gastroenterology, but for all health things, that I would say that little by little Americans are getting less and less healthy habits. So I think
Less and less healthy.
Yeah.
Yeah, it's a lot of sitting all day long, working at home on your computer.
correct.
Yeah, definitely. So your offices, you're at Montefiore, but you also have offices where people
Yeah, so
can
we have
come in.
outpatient offices at 20 Cedar Street.
20
sort of
Cedar Street.
behind the Nomo Hotel,
Okay.
Oh, yeah, that's
across from Toyota.
that's a lovely building and good parking there too.
Free parking.
Everybody loves the parking.
Yeah,
Yeah.
it's easier there than Montefiore, to be honest.
Parking in the Bronx is terrible.
Yeah,
Or, you know, even on Lockwood or
yeah, Lockwood
Sickles.
is tricky too, yeah.
Yeah.
So, okay, so what was that address again?
20 Cedar Street.
20 Cedar Street. And
Okay.
is there a number someone could call to make an appointment? Do you know that off the top of your head?
I do. It's 914-534-5121. And if you want to see Dr. Cohen, he's much busier than I am, but you can ask to see me, and I will get you set up to be on his schedule.
Okay.
All right, that's great.
Well, Denise Bird and Dr. Cohen, thank you very much for joining us today and providing invaluable advice for such an important cause. And we hope to see you around, and we hope you come back soon.
So we appreciate the invitation.
Yeah,
Thank you.
of
All right,
course.
thank you very much.
All
And
right.
everyone,
Thank you.
March is Colon
Yeah.
Cancer Awareness Month, so
Yeah.
schedule your colonoscopies.
Don't delay.